Welcome everyone. So now we will be looking at polyhydramnios and oligohydramnios. Now when the amniotic fluid is increased, that condition is known as polyhydramnios, and when amniotic fluid is decreased, that condition is known as oligohydramnios. Now polyhydramnios, it is a condition in which increased amount of amniotic fluid occurs, and amniotic fluid is greater than 25 centimeter amniotic fluid index. That condition is known as polyhydramnios, and it occurs associated with a fetal abnormality if amniotic fluid index is greater than 40%. Amnioreduction, drainage of excess fluid with a needle, can be performed in order to decrease the amount of increased amniotic fluid. So the polyhydramnios is associated with diabetes mellitus. Urgent investigation is performed for glycemic control, and in this way we can reduce amount of the amniotic fluid. There are certain causes of polyhydramnios like fetal cause and maternal causes. Fetal causes includes increased urine production. What happens if a fetus excrete urine and that urine is swallowed, and then in this way the circulation occurs. But what happens if a fetus has increase amount of urine production, then there will be excess amount of the amniotic fluid and polyhydramnios will develop. In maternal diabetes, polyhydramnios can be developed in twin to twin transfusion. Means they in twin, what happens, one twin shares the blood of another, and that condition is known as twin to twin transfusion. In this condition, polyhydramnios occurs. Twin recipient becomes polyhydramnic, and fetal hydro condition also present. And other causes, inability to swallow in the fetus of anencephaly, duodenal atresia, and neuromuscular condition. Polyhydramnios can develop. Placental causes includes chorioangioma, arteriovenous fistula, and complication of polyhydramnios are preterm delivery due to uterine overdistension. Because of overdistension of uterus, there are more chances of early pregnancy, and that early pregnancy will produce preterm baby and preterm birth. Malpresentation can occur because of polyhydramnios. Maternal discomfort and duodenal atresia is associated with trisomy 21. So in this way polyhydramnios present. And another condition is oligohydramnios, in which decreased amount of amniotic fluid occurs, and that condition includes decreased amount of amniotic fluid index less than 5 centimeter, and that condition is known as oligohydramnios. So the cause of this is decreased production of amniotic fluid because of renal agenesis or multiple cyst of the kidney, posterior urethral valve. That's why a fetus is unable to excrete the urine, and less amount of urine will result into less amount of fluid, and oligohydramnios occurs. So in this way this condition presents. Other causes includes placental insufficiency, post-date pregnancy, and preterm rupture of labor, preterm pre-labor rupture of membrane due to leakage. So the complication of this condition are preterm delivery occurs, same like polyhydramnios, due to preterm pre-labor rupture of membrane, intrauterine infections, intrauterine growth restriction, and death because of renal agenesis and multicystic kidney disease occurs. Related to reduced volume, lung hypoplasia occurs, limb abnormality occurs, clubfoot occurs, and fetus may develop abnormalities. So the other venous disease includes venous thromboembolism in the mother. It is leading cause of the maternal mortality and morbidity, and pregnancy is hypercoagulable state, and that hypercoagulable state will development lead to development of the embolism, and that embolus will lodge into pulmonary arteries, and pulmonary embolism can develop, and deep vein thrombus can also be developed. Risk factor are maternal age is greater than 35, obesity, previous venous thromboembolism, smoking, and thrombophilia. So these are risk factors. And antithrombin deficiency, protein C and S deficiency with factor 5 latent mutation and prothrombin mutation can predispose to this condition. So specifically, multiple gestation women, preeclampsia women, emergency C-section, multi-grain parity, damage of the pelvic vein, prolonged labor, immobility after delivery, and ovarian hyperstimulation syndrome and dehydration women are more prone to develop this condition. Signs and symptoms are unilateral leg pain will uh, present with swelling associated with the redness and tenderness, dyspnea, pulmonary chest pain, tachycardia, tachycardia, raised JVP, and syncope and collapse will occur. And the investigation will be ultrasound. Doppler is the treatment of the choice with ECG, ABG, chest X-ray, and pulmonary embolism chest X-ray can are the diagnostic point. Most accurate test will be CT contrast venograph. So in this way, pulmonary embolism can be ruled out, and treatment will be heparin and warfarin with anticoagulants. In this way, we can treat this condition. So these were diseases: polyhydramnios, oligohydramnios, and venous thromboembolism, which can be fatal during maternal period.